Assalamualaikum. Hi, my name is Azkil Mutisani and I'm a pharmacy student of Poltekkes Kemenkes Tasikmalaya. My topic is very important for you because it highlights the urgent issue of antibiotic misuse and resistance in Indonesia, a growing problem that threatens our healthcare system and public health. In left unhacked, this issue could lead into a situation where common infection become difficult, if not impossible, to treat. First of all, I want to tell you about the classification of antibacterial drugs. Antibiotics are grouped into different classes based on their mechanism of action. Each class, like penicillins, cephalosporins, and tetracyclines, targets bacteria in unique ways. Some antibiotics inhibit cell wall synthesis, while others interfere with protein production or DNA replication in bacteria. Understanding this classification is essential because the misuse of even one class can lead to resistance that affect an entire group of drugs, limiting our treatment options. Secondly, I have to say that antibiotics misuse is alarmingly common in Indonesia. Issues include situations where antibiotics are taken without prescription, are prescribed unnecessarily, or are used improperly, like stopping a course too early. These practices not only fail to treat the intended infection but also contribute to the risk of resistant bacteria. Unfortunately, in many cases, people use antibiotics for viral infection like cold or flu, where antibiotics are entirely ineffective. This unnecessary use places immense pressure on bacteria to adapt to survive, leading to antibiotics resistance. Also, you have to know that antibiotic resistance has severe consequences for public health. When bacteria become resistant, infections that were once easily treatable with standard antibiotics become life-threatening, requiring more potent, often more toxic and expensive treatments. In some cases, there may be no effective treatment options left, resulting in prolonged illnesses, increased hospital stays, and even higher mortality rates. I believe it is important to know that taking antibiotics misuse and resistance requires awarenesses, responsible prescribing by healthcare providers, and stronger regulations. Public education is vital. We need to shift the prescriptions that antibiotics are a quick fix for all illnesses. Healthcare providers, too, must commit to prescribing antibiotics only when absolutely necessary and educating patients on the importance of following their prescribed regimen. I'd like to end by saying that we all have a role to play in combating antibiotics misuse and resistance. By using antibiotics responsibly, we can help preserve their effectiveness for future generations. Let's just be productive in educating ourselves and others about the dangers of antibiotics misuse to ensure that antibiotics remain effective life-saving tools in the fight against bacterial infection. Maybe that's all for me. Thank you for your attention. Assalamualaikum.